We're talking to Dr. Michael Misalek from Boston, a very well-known pathologist and certainly a capable doctor in his field. And he's here to educate us about the role of pathologists and also, like, certainly in prostate cancer, and I know you deal with other fields. How important is a second opinion? I have patients that come in with Gleason 6, and then we have the slides reviewed, and our pathologist may call it a completely different result, which can change the treatment decisions.
Right.
What is your opinion?
First of all, second opinions, we always welcome them in the field, and I think any reliable doctor that you see will certainly encourage it and not refrain from the patient seeking a second opinion. And prostate cancer hasn't received as much press as breast cancer. Recent news of celebrity diagnoses of breast cancer have really brought to light the value of a second opinion. And I think if a lot of those similar studies were done in prostate, we would find that same level of variability in diagnoses of some of these gray zone or intermediate diagnoses, the precancerous lesions. And prostate is very similar to breast cancer in its pathology and its statistics. And I think a second opinion is always helpful. As you mentioned, basing treatment on random biopsies in which the diagnostic decision is based upon one grade score of difference can mean the world of difference to you.
Gleason 7, people come to me and they say, hey, I have a moderate risk prostate cancer. Difference between Gleason 7, 3 plus 4, and 4 plus 3. What do you think?
That's the perennial question we all struggle with as pathologists. And I think one important thing for patients to realize is that when they see that report, the printed report with the diagnosis, the many hours that have gone into that diagnosis, and it's not just oftentimes one pathologist looking at those slides, it's many pathologists. I personally will frequently share slides with my colleagues, and we often put in many hours into these slides. I would venture to say we're examining slides of your biopsy as much as your doctor visits with you in your office. So we're really the doctor behind the scenes.
That's right.
Healthcare's secret weapon, and experience does matter, just like in surgery. Experience matters in pathology, and you should definitely ask for your pathology report. Become engaged in your healthcare and educate yourselves about your health.
I like the healthcare secret weapon. That's what I'm going to call you from now on. You're the secret weapon behind helping people.